So welcome everybody to the Birds and BBB Bite. Our special of the day is we have Joe Stan here from Aqua, and Joe's going to be presenting on chemsex. And so I don't know about you, but I'm very interested in hearing more about this subject. So with no further ado, I will now hand it over to Joe.
Thank you. Hi. So, can you see the screen? Yep, you can see all this. Excellent. So today we're going to be talking about chemsex. I'm one of the public health nurses here, and there's a bit of an overview as well of what we're going to talk about when I actually know how to operate this thing. Okay, yeah, we're going to talk about what chemsex is, what drugs are involved, why people do it, what is the risk, and what to do if someone actually brings up with you as a client. They might not use the term chemsex, but the concept of chemsex still exists, and it's really important to know, I guess, what tools are in your arsenal and what you should do when that situation arises. But I just want to start by acknowledging the traditional owners of the land we meet on today, Whadjuk people of Noongar Nation. I also like to acknowledge all the lands and nations from which you are all calling from today as well. And I like to acknowledge that sovereignty was never ceded, and this always was and always will be Aboriginal land.
And also, if you want to just put any questions along the way, just pop them into the chat bar, and Joe and I will have a look at the bar then at the end of the session. If anything comes up even along the way, we should be able to answer. So please feel free to just enter any questions into the chat bar.
Fantastic.
Yeah.
So the term chemsex, there's other terms for it. Some people use the term meth sex, and some people use the term slam sex when it comes to injecting drug use. But chemsex is a concept that's been around it's been known about for about past 2 decades, but has been happening long since before then. It's just sex with substance use, but it mainly is crystal meth, GHB, and or methadone. Sometimes people also use drugs like ketamine and cocaine as well, but it's mostly the meth, GHB, and methadone use during sex that is classified as chemsex. And basically, this practice is seen mostly with men who have sex with men, but now we're seeing it more so with people of all sexualities and genders all around the world, mostly in your more developed countries, just because of the more ready access of substances in those nations. And basically, it's where people engage in sex with substances because they want to have long sex sessions with reduced inhibitions, increased libido, increased sexual sensation, and increased dissociation. So that's the term itself, but you might hear that people just say, oh, I have sex on meth or sex on drugs. But if you're looking into the literature, if you ever want to do a literature search, because there is a lot of literature out there, chemsex is the term to search up.
And what is GHB?
So GHB, gamma hydroxybutyrate, it's actually very different to meth, and I will explain that in a second. Okay. It's a very, it's an interesting drug that's actually emerging a bit with the MSM community in Australia. So we all know what meth is. Crystal meth, we know it's a stimulant. We know that crystal meth is different to speed. Crystal meth is a little bit more potent, has more a rapid uptake and therefore rapid effects. It's also longer lasting. So a hit of methamphetamine can lead up to 12 hours of effects on the body, and also as a result, because it's a stimulant, it makes it really hard to sleep as well. So a number of people who use meth would actually use a depressant, say cannabis or alcohol, to actually bring themselves down, exactly, to have a good sleep afterwards, because people take enough hits to be awake for 3 or 4 days in a row. And this is kind of the practice that you see when people are engaging in chemsex as well. They have these day-long, multiple days of sex parties, and then they would take meth that would have them awake for that period of time. They need to take depressants to counteract that. We know that meth is addictive. We know it has long-term effects. We know about the condition known as ice psychosis as well, which is not something that everybody has, but it can happen when you have medium to high doses of ice. And we know that there is a pretty severe coming down that comes with methamphetamine, and that depressants are used for people to sleep as well.
Yeah, and do they find that if they take meth, that like that first time that they've done it is like the most amazing time, but then to actually keep trying to get up to that level, they will sometimes need more meth?
So some people do, like, their body does adapt, and yes, you're right. The people, the more they get exposed to methamphetamine, the higher the dose that they would use when they're dependent on it.
Yeah.
So I know I've had clients who would start off with just one of a point, right, and then you'd see within a year or two of sustained use, they use 5 points in a session, and that's quite lethal. Like I remember having that client, and I was just like, I'm going to have to intervene because 5 points is quite a lethal dose. At any moment, you could really just completely cook your heart. So yeah, it's it does, like opioids as well, similar to opioids. You can get the sort of your body adapts to it, and that as a result, you need to increase your dose just to have that same level of effect. But yeah, we also know side effects, the effects of meth, right? We know it because it's a stimulant. It does euphoria, leads to increase in confidence, but also an increase in heart rate as well, reduced appetite, and it does actually cause sexual arousal. So meth, that's why it's very much a key drug used in chemsex, because of that link with sexual arousal.
Yeah. Okay. As some drugs do the opposite.
Yeah,
can
absolutely.
Dampen your sexual arousal.
Absolutely. Yeah, completely decrease sexual sex drive altogether. Then you've got, I've actually supposed to not put GHG in because that's not really seen as straight. It should be GHL. But GHB is a depressant, so it's on the other end of the spectrum. It's quite an interesting drug. It's usually in a colorless and odorless liquid. Sometimes it's bitter, sometimes it's salty. It's usually sold in small bottles or vials. You might hear terminology like blue nitro, or as what people refer to when they're talking about GHB. But basically, it is a depressant that causes euphoria, as well as having increase in your confidence. But it is a completely different type of high to what people who are on methamphetamine experience. It's very hard to describe because it's sort of all the terminology you can use really is that euphoria, but you also have those mood swings. Now, the problem with GHB, and I wrote that down, is that it has a very small therapeutic window. So people don't really, it's because it's the composition of GHB can vary depending on the vial, depending on your product. That means that you don't really know exactly what dose you're going to deliver that's going to actually give you the high that you want. But with that, having that small therapeutic window, it means that if you go over that window, you can actually overdose very easily.
Yeah.
So a lot of people have had a number of overdoses from GHB because of their different body composition and also the different drug composition from the product they bought, right?
So would they need like something like Narcan to reverse it? Or
unfortunately, not. It's not a Narcan specific drug. I would say it doesn't really work for it as well. This is not like an opioid, not too much of an opioid. So yeah, it's sort of the only way is really for people to just have that first aid. That's not with with naloxone or anything like that, which is a real shame.
So you'd basically like, well, what would be an overdose? What would that look like for somebody? Would they just pass out? Yeah,
so they start having these mood swings. So there might be a little bit more risk taking as well. So you might see a real change in their behavior. And then it leads to that unconsciousness. So you start seeing like the sedation that you would also see if there was opioid dependence. But then actually, yes, GHB has been known to cause a coma and death in a number of people, especially in Europe and more likely the UK. So yeah, that's just a drug that you might see more so present now than ever before, and we're definitely seeing in the MSM community. We're definitely seeing it in Perth. It's more so in the eastern states, but it's something that would also come out to communities if, say, we see an increase in chemsex practices in the regional
And
areas.
is that injected?
So it's actually consumed, ingested.
Oh, so it's oral.
It's an oral drug.
Oh, okay.
because of that small therapeutic window, you don't actually know you're high, and then you might actually, because you want to keep taking it, can actually.
I just thought you said because it comes in a small vial.
Yeah, exactly. So it comes in a
small vial. So do they mix it with something, like in a drink or?
Yeah.
Okay.
Or you could just put it under your tongue.
Oh, so so if someone spikes somebody's drink, it could be something like that they're putting in it.
It could be. It's very unlikely that you're going to have someone spike someone with GHB because it's not going to really do the effects that would say if you did it with what's the main drug that you get, roofied, you know, like it doesn't have that rapid effect. It's sort of like a slow burn, but it gets there.
Okay.
And then obviously GHB is expensive, so people don't want to really waste their product on a random person. Like I'm saying it like in a way like, but you know what I mean? Like it's sort of like that's why it's much more for recreational use. Yeah. But basically hard to withdraw if you are, it's not as addictive as meth, but it's very difficult to withdraw if you are at sustained use. You don't really see too many people actually have like sustained use. It's more sort of used ad hoc when people have those sessions. But yeah, there are definitely long-term effects, especially the strain of the heart, as with all these other kind of drugs that sort of have that same strain of the heart, even though it is a depressant. Now, methadone, I'm not going to touch on this too much just because it's sort of new. We're seeing it in Europe. It's what's called an NPS, which is a new psychoactive substance. It's sort of like it's sort of like a drug that's been made to be like meth, but also it's like the baby of meth and MDMA. So imagine it's got the stimulant effects of meth, but the psychoactive empathogen effects of MDMA. And so, yeah, it does cause a number of deaths in Europe, again, because a lot of people have just been mixing it with meth because they're like, oh, I still want the stimulant effect and I'm going to have some meth, but I also really just want to experience a lot of like hallucinations and stuff while I'm doing stuff. And then you have things like increased hallucinations, increased harm activity, because it's almost similar to the ice psychosis, but it hasn't got a defined term yet. And then as a result, increased death. So that's something you might see emerging, but only really in the metro areas. It's more the meth and GHB that are quite prevalent.
Okay.
When it comes to chemsex. Now, as I think it's important to touch on this as well, that there are other drugs to consider too, that are not really under the umbrella of chemsex, but do have that influence. So, for example, alcohol, we know as a depressant, a lot of people have sex with alcohol, but say when you mix alcohol with something like meth, there's actually a legitimate interaction where there's increase in risky behavior taking. Your body is under a significant amount of stress. You get severely tachycardic. Your blood pressure is all around the place. It goes hyper, then hypotensive, like all the time. And the likelihood of your overdose from meth when you mix with alcohol is severely high.
Okay.
And when it comes with alcohol and GHB, you actually get the opposite effects. So you get a really decreased heart rate. So you become like, 60 beats per minute, if not lower, as like that's the most rapid you go. And then as a result, you also can have an increased likelihood of overdose as well. So that's why we mentioned alcohol, because a lot of people, alcohol is just so readily available. So when people have chemsex,
and it often comes, it goes with other things.
Absolutely, it's way too easy to access. It's sort of a conduit to engaging in these kind of situations in the first place. We also know alcohol is very addictive, like it's the most relied on substance in Australia, in the world, and it's also one of the most dangerous to withdraw on as well. So if you have a very high alcohol dependence, so difficult to withdraw, and that's why people have diazepam to actually withdraw from that. So it doesn't cause that complete heart shutdown. I also like to mention erectile stimulants. So people definitely engage in Viagra during chemsex parties, because even though meth is a sexual arouser, it can cause erectile dysfunction, right? So as a result, so people take Viagra. Yes.
Wow, that's interesting.
I know. So this is what I love about chemsex, right? Not that I don't do it, but I mean, what I love about it is that there's so many complexities and so many interactions that it's
like you've got to take something because this one is causing a side effect. So you take that to deal with the side effect. It's a bit like that.
Yeah, it's polypharmacy, right? It's almost like, and it's just a toxic cocktail of drugs, but it's also, it's fun to learn about. So we know Viagra is a vasodilator. It's used for a number of health conditions.
Which would cause your blood pressure to drop.
Exactly.
So if you're already taking something like GHB, which causes your blood pressure to drop, then you take Viagra on top of that, you could end up just passing out because your blood pressure just drops
Absolutely,
rock
yeah.
bottom.
So you get that severe hypotensive episode, which requires first aid, and this is one of the most common things that happen in chemsex parties is people passing out from what I'm going to mention is the amyl and Viagra combination. So Viagra, we know, is a vasodilator. You also see amyl nitrates is also a depressant and vasodilator. It's a very easily accessible party drug. Why men who have sex with men use it is because it dilates the anal sphincter, so it makes it a lot more relaxed and makes it more easier to have receptive anal sex, but also increasingly seen with cisgender females as well, because it has the same effect on vaginal tissue too.
Wow.
So it has
Okay.
a similar effect.
And where would they get that from?
So you can get this, and I shouldn't be saying this because I mean I've had amyl before. I'll say where I usually have gotten it from, and that is from like sex shops. You can go to sex shops and buy them. It's under the terminology leather thinner, or what's the other one? I mean, just call it jungle juice. It's called poppers.
Oh yeah.
That kind of terminology.
Yeah.
But you say leather thinner when you go to a sex shop.
Okay.
But it's technically illegal in Australia, but it's very easily accessible online. It's easily delivered to your house. I don't know how they get away with it, but they do. So amyl and Viagra, people take that because they're like, I want to do insertive and receptive sex, right? But as a result, because they're both vasodilators, you can get that severe hypertensive episode. Then you've got meth and amyl. So amyl being the sort of like having that nitrate effect where it, you know, dilates. It softens everything, dilates your blood vessels up, lowers the blood pressure. Then you've got meth that's increasing your heart rate with this low. It's completely sort of opposite situation happening, and it causes such a strain in your heart. And it's insane. So people can also have a really bad overdose from amyl and meth as well. So why I'm mentioning all this is because if someone discloses to you they have sex with drugs, having questions that ask, oh, what kind of drugs you go on is really good, because when you're having a conversation about harm reduction would involve reducing polypharmacy. So these are good things to know.
Maybe that awareness of, you know, did you know that? And here's some information on, because things like, I mean, you'd end up with some chest pain. I mean, it says strain on your heart, but how would they know there's a strain on their heart?
Absolutely. And it's usually not until like someone gets like the later sort of effects, because if you're under the influence of substances, you might not be able to recognize those effects on your body straight up. Like, will it feel like a heart attack? Will it feel just like crushing chest pain? It depends on the person, because of their
or palpitations perhaps is
yes.
what you might feel, because you've got this increased heart rate.
Absolutely. But when you're under the influence, that's not on your priority. No. Like, that's not on your mind. So all very interesting stuff. And like, I love this kind of stuff. So if you have any further questions, please feel free to ask me. And if I don't know it, I'll point you to the resource that does have it. So why do people do chemsex? That's a big question we're asking. Sounds pretty fun, doesn't it? Yeah, it does have an increase in sex drive. That's the whole idea, right? People might feel anxious about sex in general, being anxious being group sex settings, so it decreases your inhibitions. And that's why you see chemsex in more group sex settings than just on one-on-one. Does that kind of make sense?
Oh, yeah, absolutely. And I mean, if you're in a group situation and it's offered to you and come and join the party, like I can just see it so easily being something that people would want to do.
Absolutely.
If that's their social group.
Especially if their social group doesn't talk about the negatives, they talk about all the benefits of it. And you see the effects are, my friends are looking pretty euphoric at the moment. And also peer pressure, I want to be included. This is why people like sort of engage in chemsex. You have one person that does it, and then there's sort of the domino effects, and pretty much everyone's recruited to do it. It intensifies sex. People and qualitative studies say that chemsex is probably the greatest orgasm they've ever experienced.
And that would be addictive.
That would be addictive itself.
Like you'd want to, in fact, you know, sex after that wouldn't be.
You would have sex without chems, and you wouldn't feel the same. And it's sort of after that first hit, you're sort of like, I don't think I could actually return back to non-substance derived sex. It's quite interesting. And that's what's said in a lot of qualitative studies. So we have had studies in Australia showing, I guess, qualitative experiences of people engaging in chemsex, both male, female, and trans. But most of the studies you will see are in the UK, Netherlands, Germany. So they're if you're looking at the literature, that's mostly from there. Increased risk taking. So people want to engage in some more sort of high risk practices that might encourage more pain. So I'm not sure if you've all heard of the practices of like sounding and fisting. Fisting is obviously putting a fist up your anal or vaginal cavity, while sounding is putting rods into the urethral passageway. And that's supposed to, that sort of pain receptor, when you take meth, it's almost like it doesn't activate the pain receptor necessarily, but it sort of activates a pain pleasure combo pathway.
Oh, okay.
And that's why people love doing those kind of activities
Yeah,
while
because
on
it's such a fine line between pleasure and pain. There's a song
Absolutely.
about that.
Yes.
Um,
And it's
but
actually about fisting, can you believe? No.
yeah. Oh, okay. Yeah.
So then you
Interesting.
have,
But I guess
yeah,
that's where we can help support as
absolutely.
healthcare providers, is that that increased risk taking that can apply during these times, is like, just talking to people, to have those barrier methods available.
Absolutely.
For example, your dams, your
Your gloves.
condoms, your gloves,
Yeah.
lots of lubricant.
If you're doing sounding equipment, making sure they're sterile, because you're putting them into an internal place in your body.
Yeah, because you don't want to say to people, "Oh, you shouldn't be doing that," because they're never going to come back and see you, and B, you're not achieving anything. What you want is, you want to be just be that person on the other end that's gone, well, have you thought about this? I think it's really important that you make sure that you're looking after yourself, you're looking after your partner and your partners.
Yes.
And just and just being engaging. But
I couldn't have summarized it better myself. That's
yes,
excellent.
yeah.
Yeah.
I know. I mean, look, it would be hard for some healthcare professionals not to pick their mouth up off the desk, for some people.
Yeah, especially
But
if
I think it's about information and learning and education and understanding that this is real. This is what people do.
It's interesting. The more non-judgmental art, you realize the more people will it's like a community. People will come to you and they will say more and more stuff to you. And like, I've had moments where I'm like, having worked with a sexual health nurse, I'm like, I've heard some stuff that I'm shocked, because I guess of the level of graphic detail that people would give. But I mean, and then sometimes you have to draw the lines that, I'm sorry, it's okay to, like, you don't want to like ask them to just like swear at you, and because that's how comfortable they are.
Yeah.
But sort of you still have that responsibility as a health professional to be able to hear them out and understand why they're sharing this with you, because like maybe they're worried about risks, maybe they're wanting to change their behavior. There is usually an underlying story behind why people can be quite descriptive about their sexual practices to you.
That's right. And you should almost feel a bit privileged that they're actually opening up to you.
That's a pretty big deal.
So in a way,
I don't think I would ever show like that kind of stuff with anyone.
I'd be very thankful to say, look, I think it's great that you're talking to me about this. And
it's good, isn't it?
Yeah.
So in terms of risks, what are the risks with chemsex? We know that polypharmacy is a big issue. We've already discussed that. Combining different drugs together, combining the drugs and alcohol, combining, say, your erectile stimulants and amyl nitrate with these drugs, all has different strains on your body. And as you can see, it can lead to poor long-term health deterioration and poor mental health, especially between sessions. So that sort of is the lows that people get between sex sessions, because of the massive come down that comes with having multiple days of meth and other drugs, means that it can lead to that increased reliance, increased dependence, and almost like living for the next high. And so, we get this addiction to substances that's seen very much so in the community that engages in chemsex, and also addiction to sex, which can be damaging for all the relationships that people have. We know, again, it's pretty much a given, but with increased risk taking, like increased condomless sex, increased sharing of injecting equipment from chemsex, there's that facilitated STI and BBV transmission. We see a very significant relationship between chemsex and HIV and Hep C acquisition. So that's something important to keep in mind. Sexual assault is also something that's very important to keep in mind, because a number of people who engage in chemsex sessions, the lines of consent become very blurry, and as a result, they encounter situations that they never wanted to be in the first place. And as a result, they can disclose some pretty graphic stuff to you. And I know I've had a number of people who have done that for myself. So that's something important to consider, that there might be a disclosure of sexual assault. because
Yeah.
these parties are sort of like people come and go, people
Yeah.
enter and leave, and you don't know who's coming in and who's coming out.
Yeah.
Overdose during a session as well is a very traumatic thing. Not only the overdose of the person themselves, but even witnessing an overdose can be traumatic in itself. Like imagine being in a setting where your person you having sex with overdoses with while they're with you, you know, like, and then you have to practice first aid. It's a massive toll on that person. So that's another thing that is a major risk, you know. Is there anything else you can identify, or you think that's pretty much covering it? Because I put the ones in the literature and I added a few other ones that I
think
thought
the
was
mental
sexual
health, because I also think too about, you know, perhaps engaging in this on a regular basis and then trying to hold down employment, or perhaps also about, you know, not being too nervous to access health service, because that you know, you're sort of scared how people are going to respond to you.
Yes.
And also we're talking to a lot of people that work in community. I mean, if you come from Perth, you do have the M clinic, you know, for men who have sex with men, which is so wonderful. And you've got sexual health clinics, but out in community, you know, they might just have their local clinic, or
and community is small and everybody knows everyone, and that's a big barrier for people accessing those services.
Yeah,
they
so that would hold them back.
Yeah.
Which means that, like any STI or bloodborne virus, many of them are so treatable and preventable, but only if you get regular checks and you get early treatment. So
yeah, no, that's a very big point as well. Thank you.
Yeah.
So in terms of what happens if someone discloses they engage in chemsex, and I see Helen has a question. So how about, Helen, what's your question?
So sorry to interrupt, guys.
Please interrupt.
Go for it.
Well, I was just wondering if you in like a clinical setting have noticed like physical injuries as a result of these chemsex parties. So maybe like some tearing in the genital area or something that potentially could lead to infections or anything like that. Is that quite common?
So
good question.
100% is definitely the case, that there is that increased risk. I don't know if I would say I personally have seen the relationship, but in the literature, it definitely says that there is increased trauma to mucosal tissue, whether it's your urethra, anal cavity, vaginal cavity, as a result of chemsex, because of, I guess, it's hard to say, but like prolonged sex sessions, paired with the risk-taking processes, whether it's lack of condom and lube use, and or like lack of sort of stopping having sex safe, like there's things like bleeding come about because people are not seeing that present because they're engaging in that sort of they're sort of keeping with that high. So yes, 100% there is definitely increased trauma to tissue, and that means increased risk of infections, not just your regular ones, but you definitely see LGB with in the anal cavity for men who have sex with men, more so in the eastern states. Definitely is the case, 100%.
And I think too, when you mentioned about like the fine line between pleasure and pain, so pain being something that could be actually traumatizing soft tissue, but at the time your pleasure feeling takes over, so you wouldn't recognize the fact that there's trauma happening.
So a lot of men would engage in anal, for example, because, you know, having anal sex with a sphincter that's quite tight, that's your body saying to you, yeah, don't go inside me, right? Or don't tear me open. But anal sort of helps you forget about that because it relaxes the tissue. It also helps you sort of forget about that. You're still going to experience that tearing. It's just you won't feel it. And so that's why, that's sort of linked with that too.
I guess where I've seen it is probably more so with sex workers.
Oh, yeah.
So, you know, and that's for sex workers who may not work in like a brothel situation, but rather like from their homes. And I was going to ask you that actually, whether or not, you know, people who then access sex workers could also be on chemicals that would give them a bit bigger sex drive and then present to a sex worker as well. But I've seen sex workers with like, you know, the vaginal mucosa has torn from, you know, I guess long periods of sex, not necessarily being assaulted or anything, but just having sex for a long time over quite a few hours. And if this is what chemsex provides you with that ability to be able to have sex for longer periods. I would imagine that the tissue in soft tissue would definitely get
100%.
Damaged.
Yeah, 100%. So I can imagine that. Again, the literature around sex workers with chemsex is really only from London because it's so prevalent there.
Yeah.
But yes, definitely.
I guess it's something to think.
With sex workers, 100%.
Yeah.
Interesting
Yeah,
point.
I think it would be really great, and I've spoken to Lena at Magenta, which is the sex worker clinic here in Perth, and I would love Lena to come and do a talk.
Oh, Lena would love to do a talk.
Yeah.
Absolutely.
Yeah.
They're just an expert in everything. I love them. So what would you do if someone discloses they engage in chemsex? Are you going to run away? Are you going to freak out? Or are you going to be a normal health professional and be open and non-judgmental, discuss harm reduction strategies, and provide support if they want to reduce their use? There's sort of, I like to always have 3 key points when it comes to any kind of significant health concept. So we'll go through those in detail. But when it comes to being open and non-judgmental, it is a really big deal for someone to disclose to you the fact that they engage in chemsex. Usually there's an underlying reason as to why. They wouldn't be disclosing it to you necessarily because they just want to let you know that I'm enjoying it so much. Like there's usually something that they want an intervention wise, and they need to talk to about someone that's not within their social network, because otherwise they would just talk about the chemsex to their sexual partners, right? So it's really important that at that moment, you just need to switch off your personal values you might have about substance use, about LGBT people, whatever, and just be open and non-judgmental, because right now we know there's so much stigma and discrimination for people that uses substances, for LGBTIQ plus people accessing health services. So we want, and because they're all minorities. So I think as Archer staff are really in a very good place, because Archer staff work with Aboriginal people all the time, and Aboriginal people get discriminated by mainstream healthcare services all the time. So I would hope that in Archers that they would show the same kind of level of care, standard of care towards people who use substances and people who are LGBTIQ plus. So there are reasons that people do what they do. So you should really leave your preconceived notions at the door and actually be their advocate. Don't ask so many questions because you're curious. Ask questions because they're clinically relevant. So that's the whole idea about being non-judgmental. If you're actually asking questions that are like, oh, tell me a bit about like this practice, or how many people did you stuff into your hole on the weekend, you know, things like that. I'm being quite graphic, sorry. But like, that's not productive. What's productive is asking them, okay, do you share your needles with your sexual partners, or how many points of meth do you do in a session? These are constructive questions because they're going to help with understanding the level of risk the person's at. So make sure
and what care they need.
Exactly. Clinical curiosity, not personal curiosity. I think is the main takeaway.
Yeah, that's good.
I just made that term up. Great, clinical curiosity. Promoting harm reduction is important. We know what harm minimization is. It's a combination of demand reduction, supply reduction, but also us as health professionals, our key focus is on harm reduction, which is about promoting low risk or medium risk behaviors, reducing high risk behaviors with people, and providing safer settings for people to engage in activities, I guess. Now, how would you do this in terms of chemsex? This could be as something as simple as a needle syringe and exchange program. So we have a heap of NSEPs in Perth. We have a heap in the hospitals and regional areas. I don't believe any of the Archers have any NSEPs apart from Derbil, but that's something that can easily be taken on. So if you are passionate about having an NSEP service at your Archers, I would recommend talking to your clinical leads, talking to your upper management, because it's not that hard to implement and it's very easy to regulate, and WA Health will provide you the equipment for it.
And the training.
And the training.
Yeah, and the support. Yeah.
100%. So please, if you are interested in NSEP service, it is more good than harm. There's almost no harm that comes with setting one up. There's a lot of preconceived notions about, oh yeah, we'll be promoting that kind of service. No, you're promoting harm reduction. You're not promoting drug use.
Yeah.
You're just providing a service to people that are already doing that practice. You're just making it safe for them.
Right.
So promoting sexual safe sex is important as well. Obviously condom use is good, but then also we have to consider PrEP as well. So if people are engaging in chemsex, they're really pretty much on the top tier criteria for PrEP.
Which is another drug they're taking on top, but such an important one.
Absolutely.
Is pre-exposure prophylaxis for HIV.
You actually bring up an important point, because there definitely has been research into whether or not PrEP levels are interact when someone's on meth, but actually it doesn't. So meth and PrEP don't interact, and to the point that it reduces PrEP's efficacy. And in fact, guidelines show that it's recommended that if you are engaging in meth in any way, even if it's not sexually related, going on PrEP is probably the best thing that you could do.
Okay.
So that's something important to know.
Okay.
And you can definitely look at that up in the PrEP guidelines. It's definitely there.
Okay.
Promoting single-use injecting practices and not sharing injecting equipment with others. And of course, another thing that's important that might be a bit out of your scope, but something that you can refer a person for, is educating them on overdose first aid. Because if they are engaging with people that use substances, it's important that we boost the community up so that we can less people die from overdoses. I don't think that's fair, and I think we all have the role to play.
And maybe that's something that, you know, if they regularly do it with a group of people, ensuring that there's at least one person in that group that actually does know how to do naloxone first aid, has actually got some naloxone, so that you've got that on board and you actually have a plan in place, like, righto, we're going to do this, we're going to do this today, we're going to take this, so-and-so's our first aider, the naloxone is going to be kept here. So you've got a plan in place should someone actually overdose.
Yes, absolutely. I think it's always good to have a plan. Like you would with any other sort of parties, with like you have a plan of like what the food you're going to have, and when people are going to be leaving, the same sort of thing. There should be a plan for an overdose when it comes to a chemsex party.
That's right. When there's a fire, meet there at the where do you meet? Out the front, you know, there's plans for
That's how
Not
this
that
is
I
how
do
we
that
normalize that.
party,
That's how we
should.
normalize that kind of stuff, you know. And then finally, helping someone reduce their use only if they are in that level, a stage of change for it. So I'm sure we all know about the stage of change model. Some people are at pre-contemplation or contemplation, where they're sort of, maybe I want to reduce my use, or maybe I want to stop using altogether. And it's at that contemplation stage where we can play a role, where we're sort of like, we can plant the seed and then also provide people resources so that when they come in next time, they can actually act, because you're providing them the preparation tools involved. If someone's at pre-contemplation, you can plant the seed, but you should not be acting the same way as if they were in contemplation stage. You should really just be like, okay, understand, totally fine. Here are some resources about just reducing harm, and I guess the risks that are associated with drugs, and that's it. Because what you're doing is you're giving them the material for them to make their own informed decision, because everyone's their own autonomous human being. Okay, you've determined they're ready for change. Now what? You want to probably engage in some sort of strength-based conversation, looking at what are the strengths in their personal life, what are their protective factors. From that, you can then have, I guess, implement what's called motivational interviewing techniques, which I'm not going to go through, but it is a very well-known strategy that especially registered nurses, but it can also be used for Aboriginal health practitioners and workers, and with doctors as well. A good strategy for them to have conversations with clients about changing health behaviours.
Yeah, and you're working with them, so you're actually working with their strengths, which are very individual.
Imagine they're leading the conversation. So it's almost like you can even say it sort of goes hand in hand with clinical yarning as well. So I think motivational interviewing might have a bit more of a drive to it, but clinical yarning is very much the structure that you want to go about when it comes to motivation, having these kind of conversations. Yeah, because you want to motivate the person to want to change.
Yeah, that's
inspire them.
Yeah, and work with what they've got, not with what they haven't got.
It has to be realistic, and that's why I've also put down SMART goals. So SMART goals, if you like having something a bit more systematic, setting up a SMART goal is really good, because it means that there is a measurable outcome and I guess a motivation behind reducing their use, and it's done incrementally. It's done small changes make a big difference rather than large changes that lead to, as you can see, a relapse. And we want to reduce the likelihood of relapse. It's not like it will be unavoidable, but it's important that we don't want to have a large number of relapses, right?
Yeah, and keep in touch. So therefore, you know, always include some follow-up. So that's important.
Fantastic. So to summarize, we know what chemsex is. It's sex with substance use. MSMs are mostly engaging it, but we're seeing it rise in all communities, and it has now becoming a very much an emerging public health challenge. We know the drugs that are involved include meth, GHB, methadone, and also interactions with alcohol, Viagra, and Amor. We know there are reasons for people engaging in chemsex, and that's okay. But we know also that it can be dangerous, addictive, and it leads to increased STI and bloodborne virus transmission. So it's important for us clinicians to be open and non-judgmental when people bring this up, that we discuss harm reduction strategies and we provide the support to them if they are wanting to reduce their use. Anyone have any questions?
I've gone a bit over. Sorry.
Yeah, sorry everyone, but I'm quite passionate.
I really like your presentation, and we should have like more of it, and what we should really do is bring it to our AMSs and do a presentation on it for our doctors as well as for our nurses, because when I think about the clients that I see, that's probably what they're having, some of them.
Oh, really? And you're,
Yeah.
Tracy's in Derby.
Yeah,
Mm.
okay.
And you hear about these party drugs and groupies and stuff like that, but I never thought much about it until I've listened to your talk, and it's really got my mind going overtime here, thinking about things. Yeah. And some of the things, you know, like why they're not giving up names and stuff like that, you know. Gee, very interesting.
Right,
I really enjoyed your presentation.
Oh,
Thank
that's
you.
good, Tracy. Well, we've recorded it, Tracy, as well, so you're more than welcome to, you
Please
know,
send
maybe
it.
show
Yeah,
session.
no.
Or
Sometimes I can't get into it, the ones that you record, but how you sent it, the last one,
Yeah.
I managed to get it in. But this is deadly. I really want our doctors to see this. Yeah.
Cool.
Yeah.
Well, what we can do is I can like distribute out the video to say our clinical leads, because we've got a clinical lead group sort of email chain, so I can send it out to them to distribute out to their staff and go from there. I can do that.
Absolutely.
If you like.
Yeah. No, this got my attention.
I'm
Yeah.
glad. Fantastic.
I want to learn more, you know, just hungry to learn more stuff, you know.
Yeah, absolutely. And I'm hoping, I think it'll be good to discuss one day, especially when we get more Australian literature, definitely around that, because I know, and this is something, there was a study done in South Australia recently around chemsex practices at a service, and it's statistically significantly seen more so with Aboriginal than non-Aboriginal men. So it's definitely much a practice that is quite relevant, especially in South Australia. Nothing in Western Australia in terms of research as of yet. But we'll keep you posted if there is anything.
Yeah.
And thank you everyone for attending. I love talking about sex, clearly. So hopefully, if you've got any other topics that you want me to talk about personally, and myself, actually no, both me and VO team, if you have any topics that you want either of us to talk about, please let us know.
Or if you want to talk about a topic, I'm always hanging out for people to join. That would be good. You can just join us here on the couch.
We should actually get a couch.
We should get a couch.
And it should look like a penis.
Oh, okay.
Or no, actually no,
What
like
about a
labia
vagina?
major and minor. No.
Labia minora.
Yeah, labia minora. Sorry, labia minora. So imagine like the lips being the sofa. That would look cool. I feel like that's.
What do you reckon, Tracy?
Absolutely. Look, I just love whatever you present to us.
Couch.
Yeah. We need to all meet up in Perth one year, have a big rally.
Yeah, we do.
Let's do it.
Yeah. Now, and Veronica, from you started off with all your little stir fries and your BB. They just been so fantastic and so useful, and the information is just really deadly. Yeah, thank you.
That's good, Tracy. No worries. All right, well, we better let you all go. We better get back to work, and
yeah, definitely.
We'll see you all next week.
No worries.
Yeah,
so
all right.
Tune in.
Yeah, tune in next Tuesday. All right.
Bye.
See ya. Bye.
Bye, everyone.